onset and degree of pregnancy symptoms will vary within women. Many women experience them within days of conception, others take a few weeks before pregnancy symptoms kick in, and a lucky few feel no discomfort at all. The early pregnancy symptoms we are discussing in our video can be felt once implantation occurs, that is 8 to 10 days from ovulation, and will lessen after the first trimester. Normally, you get your period about 4 weeks from the start of your last period. But if you are pregnant, the clearest sign at this point is a missed period. Many women still feel fine at 4 weeks, but others may notice sore breast, fatigue, frequent urination and nausea. You should wait to take a pregnancy test until the week after your missed period for the most accurate result. If you don't want to wait until you have missed your period, you should wait at least 1 to 2 weeks after you had sex. If you are pregnant, your body needs time to develop detectable levels of HCG. First home test can detect HCG as soon as 8 days after the missed period. A pregnancy test will be able to detect HCG levels in your urine and show if you are pregnant. It takes 2 to 3 days for the sperm to meet the egg and 2 to 3 days for the egg to travel down the fallopian tubes, 1 to 2 days for the fertilized egg to implant, and another 2 to 3 days for the level of HCG to develop or build up enough in your system to get a positive result on a pregnancy test. The most frequent symptoms in many women are nausea and vomiting. Nausea and vomiting may come as early as a week into the pregnancy. Many women experience illness in the morning, also called as morning sickness, some in the afternoon or evening. Others feel nausea throughout the entire day. There is no explanation as to why a pregnant woman feels this or even a solution as to how to prevent it. However, eating small frequent meals and snacking on salt and crackers seems to give some kind of relief. Eating a protein carbohydrate at bedtime tends to lessen the nausea that occurs in the morning. Try an apple and a glass of milk. Frequent urination. Pregnancy causes the uterus to swell and it will start to enlarge for the growing fetus immediately. The uterus puts pressure on your bladder, making you feel the need for more frequent urination. Many women start to feel the symptoms within a week or 2 after the pregnancy has occurred. Breast tenderness. Breast may be very tender, swollen and start to enlarge. Many times the veins within the breast will become more visible. Your nipples may start to darken in color, become more erect and be extremely sensitive. These symptoms are due to increasing amount of HCG hormone that begins at implantation. Feeling tired. This one is pretty obvious when pregnant. Your body is going through some major hormonal changes. Your temperature is also higher due to the amount of progesterone circulating through your body, which will also make you feel a little sluggish. Period or light bleeding. Light bleeding may occur approximately 8 to 10 days from ovulation. It usually happens around the same time you would have gotten your menstrual period. Some women assume they have started their period when in fact they are pregnant. The spotting is caused from implantation, which is when the fertilized egg burrows into the endometrial lining. Dizziness or fainting. When standing in one place, you may feel dizzy or even faint. The growing uterus compresses major arteries in your legs, which causes your blood pressure to drop, making you extremely lightheaded. Skipping meals or going too long without eating may cause you to feel dizzy or faint. When not eating frequently enough, it causes low blood sugar. Blood sugar is the primary source of food for your baby, so it will be depleted much more quickly. Constipation. Pregnancy hormones will slow down bowel function to give maximum absorption time of vitamins and nutrients. Unfortunately, this symptom usually only gets worse as the pregnancy progresses. Heartburn. The uterus is very swollen and start to push upward as it grows. The increasing levels of HCG will also slow down digestion, making your stomach not empty as fast, which increases the stomach acid. Body changes during pregnancy are expected. As your pregnancy progresses, you will experience physical changes including backaches, weight gain and fluid retention. Symptoms like these, while uncomfortable, are normal and often will go away after you give birth as soon as your pregnancy progresses. Itchy skin. It is not uncommon to feel itchy as the skin on your breast and belly expands. Some women also find that their palms and the soles of their feet get red. You may also find that certain conditions which normally make you itchy, such as dry skin, eczema or food allergies, worsen during pregnancy. To reduce discomfort, avoid taking hot showers or baths. Use mild soaps and moisturize liberally with lotion. So, don't get afraid with any of these symptoms. Meet your doctor immediately if you find any of these symptoms in you. Take proper advice from your family doctor and plan ahead for a healthy baby. If you like this video, share this video to your friends and family members and don't forget to subscribe to our channel. Thanks for watching this video. Bye bye.